depends on my person. Do I need to have somebody in this position? Are they going to be balanced enough to be able to stand and hold that position? Maybe, maybe not. We'll gauge that patient individually. Okay? Going to be all stretched out. Make sure you're switching legs as we're practicing some of these, so you're not just doing one. Yeah, or go home and do the other side. Okay? And then advance. Again, okay, look, ballistic repetitive quick motions or dynamic. We can do a walking lunge, side lunges, yoga, things like that that are going to be a little more dynamic. So again, what Anna and I were doing before is more of a ballistic kind of a stretch that we can get forward and stretch out the hamstrings, doing any kind of a more of a dynamic movement, sport specific. A lot of warm-ups that you see that are done, those are just limbering up, getting the blood flowing, stretching while you're moving through quick patterns. Okay? All right, so that's basic stretching for knee flexion and the extension. So let's talk strengthening now. So you need to have a good balance depending on what the patient's needs are. So we're not going to stretch anything that's already hypermobile, okay, that's not tight. Okay, and then we need to strengthen anything that is weak. So we need to have a good balance, and it needs to be patient specific. We're not just going to say, well, stretch this one, and oh, you might as well stretch the other direction as well if they're not tight. Same thing with strengthening. For our population, for rehab, we're not going to say, well, let's strengthen your quads, but while we're at it, let's make sure we get your hamstrings as well, if your hamstrings aren't weak. So you need to make sure that you're following your evaluation, and if we've got a manual muscle test of 5 on the extension, we're not going to prescribe a patient a quad exercise for knee extension. But if they're weak in their hamstrings, maybe they get a grade 3 or a 4, well, we're definitely going to strengthen hamstrings. So be aware of what your evaluations say. It's not necessarily like an overall general fitness program. So in strength and conditioning or personal training, we want people to have a nice overall program fitted to their needs, definitely, but we're looking at more of an overall program to have everything stay balanced. But for us, for our rehab population, we're looking at what are your specific needs so we can get everything up to the same level. Then they can go on that good maintenance overall program where everything's balanced out. Okay, so for strengthening, now it's the same thing. So for knee flexion, to strengthen the knee flexors, we are strengthening the hamstrings. It's the same direction, the same muscle. So I have some difficulty with my hamstrings, so I need to strengthen my knee flexion. I need to strengthen my hamstrings. So for basic exercise, this is going to hold true for all of your strengthening, for all of your muscle groups, for all of your joints. Basic isometrics are always going to be a good basic start. So if I need to strengthen my hamstrings, my knee flexors, doing an isometric exercise, dig your heel into the floor. So you can do it sitting, you can do it standing. Typically my patients, they're going to be in supine. I'm going to run over you guys when I hit this. They're going to be in sitting or maybe even long sitting, and you're going to dig your heel in like you're trying to slide your heel back to you. Okay? So you should feel that hamstring contract. Okay? So dig your heel in, and you're going to hold it somewhere between 5 and 10 seconds, depending on patient tolerance. But isometrics are always a good basic start for any patient. Okay? Just dig your heel in. This is easy. They can do it sitting in their chair. They can do it at work. They can do it first thing in the morning, last thing at night. I try to incorporate exercises into what patients do throughout the day anyhow. So this is an easy one that you can do. Just dig your heel in, like you're trying to pull it to your backside, like you're trying to flex the leg, and you'll feel that muscle tighten. And that's a nice isometric hamstring contraction. The other thing that's really good that's a basic exercise is just an active assisted range of motion. So if you have somebody who is limited in their knee flexor strength and they can't go all the way, we were talking on our range of motion measurements, we may test someone actively, we may test them active assisted where we help them but they're doing as much work as they can, or we may test them passively. So if I have someone that needs some hamstring strengthening and maybe they can't pull their heel up all by themselves, I'll have them use a strap and help themselves. Okay, they make little straps that people can use. Have them use belts, a towel, whatever it is. Sometimes I'll just have them use their other leg if they're lying in bed, and just help themselves slide up and back down. So every time I slide forward, or every time I slide back towards my backside, I'm just giving myself a boost. So I go as far as I can on my own and then give it a boost. I can even do it with my hands, okay? As long as they're not cheating and just rocking back and forth here, okay? So active assisted, or even active once they can do it with a little bit of assist, then just have them do it actively. That's another basic exercise. Very, very safe, very low level, but I'm getting some strengthening. All right, intermediate. You can do prone or standing knee flexion and progress to resistance. So we talked about some of these in the last couple of labs as far as concentric and eccentric and what gravity is doing. So everybody stand up. Okay. So nice and tall. If I'm going to have a knee flexion motion here, gravity's pulling down on me, right? As I do this, I want to watch the position of the pelvis. So same thing I showed before with the stretch. I don't want patients to do this. See what happens? I can cheat and go, oh yeah, I'm getting my heel up there, but I'm cheating with my hip flexors and I'm hiking my hip. So you want to make sure that the femur stays perpendicular to the floor. Okay, this needs to stay down, and they're just doing a knee flexion, a pure knee flexion. So that's if a patient can stand and do it easily. If not, or in addition to, I may have them in this position, much like some exercise equipment at the gym, but just doing the weight of their own leg. How is this going to change my potential range of motion, or maybe one of those insufficiency terms
Gravity.
if I'm in prone?
Anti-gravity.
It is anti-gravity, so gravity is still pulling down on me, at least until I get to 90 degrees, or if I have a band or something or other resistance. What's happening at my hips? At my hip flexors? I'm kicking my hip flexors out of it. They cannot contract unless I hike my hips. Where when I was standing, it was pretty easy to hike my hips. Well, now in this position, I'm cutting my hip flexors, my rectus femoris, out of it. So I may end up getting to a point where if I were to pull, I'm in an insufficient position now. Okay, I can't go any further if my tightness of my hips won't let me, so be aware of that. Okay, but this is a safe position. If it's somebody who has a back problem, maybe standing and doing this might aggravate their back, but lying down, now my back, my trunk is supported. I don't have to use my core as much, and I'm not as likely to twist and rotate. Okay, so you can do prone, or you can do standing as an intermediate knee flexion exercise. All right, next on our list, single leg stance. This is one of my favorites, okay? So if I'm trying to gain some strength, I'm typically trying to gain that for functionality, not just for an exercise, but for what I need to do every day. So as I walk, I have to stand on one foot, and then I stand on one foot, and half of my time about is spent just balancing on one foot as I go to the next leg. So if I have some knee flexor weakness, that's going to affect my walking, because my flexors have to help me push off and then pull my foot through. So if I have weakness and I can't lift my foot up, my foot may drag, it may stuff. So I may need to work on some strengthening in standing and more functional positions. So if everybody stands up, I want you to just balance on one foot, and I want you to bend the knee slightly, and I want you to actually think about contracting your hamstrings and your quads at the same time and try to balance. Okay? This is a good intermediate hamstring strengthening exercise, which also strengthens your quads, and we'll get to that in just a minute. So I have patients do this when they brush their teeth. I say stand on one foot while you're brushing your teeth. If we need to strengthen both legs, or we need to work on balance, I'll say while you're doing your lowers, stand on one. Then when you switch to your uppers, stand on the other, okay? Then once you get really good, then you can do your rinse and spit as well. But I have them do that. Or if you're standing at the kitchen counter, you know, you're waiting for the microwave, you're waiting for the coffee to
You're
percolate,
fine.
whatever you're doing, you're standing at the sink, just practice. See if you can stand, you know, maybe 10 seconds on each foot, work your way up until you can do a minute on each foot. But this is a strengthening exercise. It's also good for stability. It's good for balance. And the more you do it, the more practice you get pretty good. But you think about when you're a kid, anytime there's a railroad tie or a line or something like that, you know, what's the first thing we're doing? We're doing this in tightrope walk. When at a certain age, we stop tightrope walking. So we stop working on some of that. So that's a really good exercise. It's just a single leg standing balance. Okay? So practice that. That'll be one of your assignments too. Maybe we'll have a single leg standoff one of the days in lab, and we'll see just during lab who can hold on one foot the longest. All right. So now advanced. So we've got some ballistic dynamic plyometric activities. So doing something like, we call it a butt kick in track. So I'm quickly trying to contract my hamstring. So not every activity requires a very quick hamstring contraction. Okay, not everyone. And can you feel when I do that, I'm actually getting stretch on the quads as well? So we talked about quad stretching in a dynamic and ballistic manner. Well, we're strengthening the agonists while we're stretching the antagonists. Okay, the other thing you can do is a stool scoot. So,
Yeah,
did you have a seat? Oh, a race. Come here. All right.
That's not fair.
Come on. All right, so we've got two racers here. Okay, so we're just going to race.
Ryan, you have a drag
right
coefficient
there. Okay.
advantage.
So all you're going to do is just use your heels. You're going to dig yourself and pull yourself till you get to the even with the table, even with Jeff. All right, on your mark.
Get grip on
Set.
that boot.
Go. There we go. There we go. I don't know. I think maybe the gimpy one just by this by this.
The gimpy one.
Make your therapy fun. I mean, this is fun for patients.
Let me go.
Okay? Have them scooting around the clinic or have them at home. I have people in their offices, you know, get crazy in the cubicles, and they'll have a stretch in the office. And I'll say, you know, a couple of times a day, I want you to do a stool scoot. Okay? I want you to actually scoot yourself all the way down this hallway. We can start with a small stretch. Then they can work themselves up to a larger stretch. I've even gotten behind them, and I'll hold a bungee cord and have them pull me along. So, you know, I'll make it exciting. I'll make them compete against each other, things like that. So they can do a stool scoot. And then we'll get to the other side in a moment, but they can go forward one direction, and then they can actually push themselves backward to strengthen the quads.
You can make it more difficult by weighing the stool down with cuff weights too. You can make it heavier. You can have them do it on carpet to make it look, there'll be a little more friction.
Yes, so this surface slides easily, but if you get onto a more friction surface, it's definitely going to be a little harder.
Do you usually use wheelchairs for those or actual stools?
I usually use
stools.
these kind of stools. Sometimes patients will have an office type chair, but it's on wheels,
Yeah.
and so they can use that as well, but usually the stools are the best. Yeah, as long as they don't get too crazy. Yeah, I've had a few try to tip over. It's a little crazy, but generally no injuries. Exactly, that's super good. That's really sports specific. All right, so then again, you've got multi-joint movements, yoga type movements, things like that that are definitely going to stretch hamstrings when you start looking at exercise programs. And then you're always going to make it as functional for that patient as possible. So something that's going to be either their sport, their hobby, their work environment. If they have to do stair climbing and things like that, you're going to make that as functional for them as possible. Okay, so for knee extension, to strengthen the knee extensors, quadriceps here. So basic, this is going to sound really redundant. So isometric contraction, a quad set. Just tighten the quad, and you're going to hold it. Okay. We had talked a little bit about the patella and how sometimes that we'll get weakness in the quads, and then we're a little tighter on the lateral side and our patella starts to move over